frequently asked questions about vitamin B12 deficiency. What is the function of vitamin B12 in the human body? Vitamin B12 is crucial for neurologic function, red blood cell production, and DNA synthesis, and is a cofactor for three major reactions. The conversion of methmalonic acid to succinyl coenzyme A, the conversion of homocysteine to methionine, and the conversion of 5-methyltetrahydroflate to tetrahydroflate. What foods are rich in vitamin B12? Vitamin B12 is a water-soluble vitamin obtained through the ingestion of fish, meat, and dairy products, as well as fortified cereals and supplements. How is vitamin B12 absorbed? It is co-absorbed with intrinsic factor, a product of the stomach's parietal cells, in the terminal ileum after being extracted by gastric acid. What are the clinical manifestations of vitamin B12 deficiency? The substantial hepatic storage of vitamin B12 can delay clinical manifestations for up to 10 years after the onset of deficiency. Bone marrow suppression is common and potentially affects all cell lines, with megaloblastic anemia being most common. Neurologic manifestations are caused by progressive demyelination and can include peripheral neuropathy, areflexia, and the loss of proprioception and vibratory sense. Dementia-like disease, including episodes of psychosis, is possible with more severe and chronic deficiency. Skin hyperpigmentation, glossitis, and infertility have also been reported. What are the risk factors for vitamin B12 deficiency? The risk factors are decreased ileal absorption, caused by Crohn's disease, ileal resection. Decreased intrinsic factor, caused by atrophic gastritis, pernicious anemia, postgastrectomy syndrome. Genetic, caused by transcobalamin 2 deficiency. Inadequate intake, caused by alcohol abuse, patients older than 75 years, vegans. Prolonged medication use, caused by histamine H2 blocker use for more than 12 months, metformin use for more than 4 months, proton pump inhibitor use for more than 12 months. How is vitamin B12 deficiency evaluated? The recommended laboratory evaluation for patients with suspected vitamin B12 deficiency includes a complete blood count and serum vitamin B12 level. A level of less than 150 picogram per milliliter is diagnostic for deficiency. Levels above 399 picogram per milliliter will exclude vitamin B12 deficiency. In patients with a normal or low normal serum vitamin B12 level at 150 to 399 picogram per milliliter, complete blood count results demonstrating macrocytosis, or suspected clinical manifestations. A serum methmalonic acid level is an appropriate next step, and is a more direct measure of vitamin B12's physiologic activity. A high serum methmalonic acid level will confirm vitamin B12 deficiency. What is pernicious anemia? Pernicious anemia refers to one of the hematologic manifestations of chronic autoimmune gastritis, in which the immune system targets the parietal cells of the stomach or intrinsic factor itself, leading to decreased absorption of vitamin B12. When should pernicious anemia be investigated for? Patients diagnosed with vitamin B12 deficiency whose history and physical examination do not suggest an obvious dietary or malabsorptive etiology should be tested for pernicious anemia with anti-intrinsic factor antibodies. What is the treatment for vitamin B12 deficiency? Vitamin B12 deficiency can be treated with intramuscular injections of cyanocobalamin or oral vitamin B12 therapy. Time to improvement of abnormalities in vitamin B12 deficiency after initiation of treatment for neurological deficits and anemia is 6 weeks to 3 months, and 8 weeks respectively. In general, patients with an irreversible cause should be treated indefinitely, whereas those with a reversible cause should be treated until the deficiency is corrected and symptoms resolve. How can vitamin B12 deficiency be prevented? Physicians should consider screening patients for vitamin B12 deficiency if they have been taking proton pump inhibitors or H2 blockers for more than 12 months, or metformin for more than 4 months. Patients older than 50 years may not be able to adequately absorb dietary vitamin B12 and should consume food fortified with vitamin B12. Vegans should be counseled to consume fortified cereals or supplements to prevent deficiency.
Audio Jungle. Audio Jungle.